Good afternoon. Amy Blaser, Vice President, Columbus Community Hospital. This afternoon, I have the pleasure of sitting down with Dr. Anthony White, orthopedic surgeon, Columbus Orthopedic and Sports Medicine Clinic with Columbus Community Hospital. Dr. White, thanks for joining us this
Thank you for having
afternoon.
me.
So, how's your week been so far?
Busy, getting busier. Even though right now is supposed to be the slow season, it seems to be ramping back up quickly. So that's good.
Right in
All
the heart
good
of
things.
summer in
Yeah.
the Midwest.
Yes.
That's wonderful. So Dr. White, for our viewers who may not have had an opportunity to meet you yet, could you introduce yourself to our Columbus and Platte County community and tell us a little bit about your specialty?
Of course. So, like she said, Anthony White. I grew up kind of between southeast Nebraska and Missouri, down by Falls City and just over the river in northwest Missouri. My dad is a wildlife biologist, which sparked my interest in science, and kind of took a little bit different path towards human science, and decided early on that orthopedics was what I wanted to do, just because of the familiarity with the tools. Same tools I use at home, a little cleaner, but we do mostly hip and knee joint replacements, but also orthopedic trauma, so broken bones, injuries from car accidents or four-wheeler accidents, or just falling and breaking a hip. We take care of all of that.
Great. Well, we are so grateful that you've chose Columbus to live and practice. You had lots of opportunities, and we're glad you selected Columbus Community Hospital, and definitely excited to be sitting down with you today and talking a little bit about your practice. We're about at a year from when you first started in Columbus. So
went by fast.
It has gone fast. So we hope it's many more years to come. Tell us a little bit about where you trained and how you, your path to Columbus Community Hospital.
I followed in my parents' footsteps and went to the University of Nebraska-Lincoln for undergraduate, and chose the early decision program into the medical school at UNMC, and did the 4 years there. And then the way residency works for training after medical school in a certain specialty is you apply basically everywhere and get in wherever you can. Wanted a little bit different scenery, and so we chose the complete opposite scenery of the desert of the Southwest. So my wife and our newborn moved to Phoenix, Arizona for residency at the University of Arizona. Just the patient volume and the bizarre pathology that you get down there was a perfect place for me to also do fellowship. So I did a fellowship in adult reconstruction, hip and knee replacement with the Core Institute in Phoenix as well. Being down there away from family, away from friends, and really any connections was pretty isolating. So we searched specifically for a hospital with a really good community involvement and somewhere where we could raise our now 2 kids, now 3 kids, but that was the most important for us. Just, not worrying about them going down the street and riding bikes with their friends, which they do all the time. They ride up and down with their scooters, and their best friends are next door neighbor, and we've made a home here and we really enjoy it.
Well, we're so glad that you've chosen Columbus Community Hospital, and I know that decision didn't come easy.
So everything you said about the community, yes, all of that checks the boxes, and of course that's what most people want, unless they just want the big city atmosphere, but that just wasn't for us. For the hospital in general, the main thing that kind of caught my eye is and I'm probably wrong, I don't know the statistics, but this is the only hospital that I know of that operates in the black and then uses that money to improve the community.
Absolutely. As a not-for-profit community hospital, I think for many generations, again, we have a true proven track record to be very fiscally responsible, understanding that our hospital doesn't belong. It's not, again, just because we're not for profit, though, we have a responsibility to invest back into our people, equipment, and buildings. What's your typical day like?
Typical week is Monday, Tuesday in the operating room that are patients that we have previously seen in clinic, booked for surgery for whatever ailment that they have that they need fixed. And that's usually an all-day thing, especially as things get busier. So doing 4 or 5 surgeries or more, 6 or 8 sometimes in a day, on a Monday and a Tuesday, and then a little bit of a breather for the rest of the week, where we see patients that we have operated on and patients that we will probably operate on in the clinic, meeting them or checking back in on them after their surgery to make sure they're doing well. And that's Wednesday through Friday. But mixed in there, like you said, is call, where anybody with an injury or pain or shows up in the ER, or even some outside ERs often call, I will respond to that and either go into the ER and put a bone back where it belongs, or put a dislocated hip or shoulder back where it belongs, and then either make the decision to keep them and operate on them if it's warranted, or see them back in clinic to make sure they're doing well later.
So we live in the Midwest. We enjoy 4 distinct seasons. And when you think about the specialty of orthopedics, spring and summer, it takes a lot of our community in the outdoors doing different recreational activities that can lend themselves to injuries. But then when I think about the fall and the winter, we have the snow and the ice and the higher risk for falls. So is there really a time in orthopedics that's busier than the other?
In terms of injury-related things, I would say it's pretty steady for those reasons. People are more outdoors in the spring and summer, getting into things maybe they shouldn't and that cause injuries, but then also slipping and falling on the ice or driving in a rainstorm that can cause injuries as well. So from the urgent or emergent side of things, for me at least so far, it's been pretty steady. But the elective side of things, where we plan ahead for surgery, a hip replacement or a knee replacement or a arthroscopic procedure, that definitely ebbs and flows with the seasons.
Absolutely.
And obviously the end of the year, people trying to get everything in before the new calendar year starts. And it's nicer to recover in the winter when you want to be inside anyway. So a lot of people right now and over the past couple months have decided to hold off on some surgeries so they could get through planting season or golf season.
Yes. We're definitely an agricultural county,
Yes.
so we have many of our community members that are farmers. What technology do you use here at Columbus Community Hospital?
Initially, I thought that I would need to use robotic surgery as a selling point. And not that I'm trying to sell something to somebody who doesn't need it, but why would somebody want to do surgery here versus going to Lincoln or Omaha or another big city? But to my surprise, most people don't realize we have a Mako robot that is a tool. It doesn't do the surgery for me. I like that because then I can work from home. But we get a 3D scan of the bones, and we can place the implants and plan the surgery how we want it. And then that allows us to have a more minimally invasive approach, so the recovery is faster because we've already seen everything. So we don't have to be as invasive with our surgery. And what the robot does is basically help make sure we put the implants where we planned them ahead of time. So smaller incision, faster recovery, less pain medication use. It really does make a difference, and we see it every day.
You're seeing a shift in the specialty of orthopedics. Gone are the days of some of the surgeries requiring community members to stay in as an inpatient for many years.
Like you mentioned, not anymore. It used to be guaranteed 5-night stay, guaranteed blood transfusions, keeping you off of it for a certain period of time, making sure everything healed up. But now we want you up and moving day one, and a lot of people feel well enough. I would say right now, just dependent on age and ability to recover and safety with going home, most people, a little over 50%, are going home the same day, whether that's from a hip or knee replacement. Hips are more likely to go home same day just because it's less painful, is the best way to put it. Easier to recover from than a knee replacement. But we make sure that we have our physical therapists and occupational therapists here that are really good and make sure that patients are safe to go home. So we never push anybody out the door, and we never make anybody stay. It's all based on their comfort level and whether or not they're safe. We continue to improve. Now patients kind of have the option. If there's some concerns about going home with pain that may creep up overnight, or they're just not sure that they can do it with the help that they have, more than welcome to stay the night.
When you see patients in clinic, I'm sure it's not uncommon for you to say, or even after a surgery, if I would have known I would have this much of an improved quality of life, I should have done this years ago. So what's your thoughts on that?
All the time.
Yeah.
And in fact, when I can tell somebody's just miserable with their quality of life, their knee hurts or their hip hurts or and they're teetering on the edge of deciding whether or not it's time. Yes, surgery is and should be the last option, but if you are, and it's something about the people in the Midwest just dealing with pain for so long, but if you are miserable and you can't do the things that you need or want to do, why wait? Why kick the can down the road with more injections that we've already proven haven't worked, when there can be an endpoint to your pain, and that's by getting rid of the problem. Yeah, surgery is painful, and you have to be dedicated to the recovery of it. But once you get beyond the initial recovery, your life is better, and you're able to get around and do more, and just the overall health benefits in general with diabetes and weight loss and you name it.
And that's a great segue. Let's talk about prevention. What can we do in our everyday choices and lifestyle that maybe, do you feel many of the orthopedic conditions that you do treat and manage, or is it a combination of just genetic disposition?
Yeah, that's a great question. So preventable, probably not. Delayable, if that's a word. I would say that a lot of it can be delayed in that and it's counterintuitive. So most people think, well, my knee hurts, I probably shouldn't use it. I'm going to take it easy this weekend. Yes, that's true to a point, but if you take it so easy that you're not really using it anymore, that's actually bad for it. So the cartilage, whatever cartilage you have left, which the definition of arthritis is inflammation from the loss of cartilage in a joint, only gets its nutrition from the fluid in your knee. So if you're not walking around and using it even gently with lower impact exercises, it's not squishing that joint fluid into the cartilage and nourishing it. So it actually, in theory, probably not in reality, but decays quicker. But the other side of it is keeping the muscles, ligaments, and tendons around the knee or the hip or the elbow or the shoulder or the ankle strong and flexible is also really important to help take some of the load off of that one area.
And we've made some changes with your leadership. We used to have a class or a program, Surge. Now what can our community expect? We don't necessarily have that program, but we still have very robust patient education. What would the experience of a patient be coming into the practice and working with you and your team versus maybe the historical practices of group education?
Let me back up just a little bit and say I think the biggest downfall in all of medicine is laying out patient expectations and helping them to understand what exactly the procedure and the process is to go through it and what to expect in terms of pain, recovery. 99% of that's my job. But the class that we had before helped to pick up all the pieces that, maybe somebody heard, oh, shoot, I need a knee replacement. And that's all they heard, and they didn't get anything else out of it. So helping to coach them through that, it was excellent for that. But we've kind of moved, as everyone's aware, to a more fast-paced, technology-driven society. So bringing people in for a class and going through all these steps we found to be cumbersome and delay things that needed to happen a little bit quicker, especially for the patients that come in and have a severe exacerbation and can't walk. So we've streamlined it to be able to have a surgery around 3 weeks between when they see me and when the surgery actually happens. And most of that's just having a once-over from their family doctor or a specialist.
Insurance pre-certification and all of that. So,
but we still are striving to make sure that all of that education is still there. So we have Chelsea Hastings, who's what I call the joint coordinator, kind of goes through all of that with them on the day of their appointment. And usually they leave with a surgery date, which sometimes we can pull some strings and get people in faster if it's a more of an urgent need. What I tell people is nobody can tell you need a knee replacement or a hip replacement. It's up to you to decide if, when, where. But this is my recommendation. And so I like to leave the option open. If you have family events or life events coming up, graduations, weddings, it's okay to wait until after that. It's better to actually, if that's coming up in the future, it's better to wait until after, just because if you plan around something's going to happen, something's going to get delayed.
Do you want to talk a little bit about how your clinic triages urgent issues, and then for more elective routine, I think, looking at that information, you can get a patient in the next 1 to 2 weeks. Is that correct?
Oh yeah, even
Yeah.
same day.
Yeah.
So one of the nice things about living just down the road is if you have a problem and you need seen quickly, we can just do it. A lot of times, even on surgery days, in between surgeries, I'll run over to the clinic and see somebody that has a problem. Or it's interesting how well it's worked. I don't like the set appointment times. I like to give each patient the time that they need. But I also like to be efficient at that. And it has actually worked really well to get through more people than I had even planned on during the day. And a lot of times I'm double booked with appointments, but it hasn't seemed to impact wait times at all. In fact, usually we're on time or even a little bit ahead in the clinic, but still, it's from what I hear from patients, they still feel like they're listened to and they get a good experience and don't feel rushed out the door.
Well, and I guess I would stand behind that. I mean, we are continually in hospital administration receiving very positive feedback from our community. Their patients are very appreciative and of your bedside manner and your clinical excellence. And we're just, again, very, very glad you chose Columbus Community Hospital. So let's go a different direction and talk a little bit about you personally.
Well, like you said, full-time orthopedic surgeon, also full-time dad, full-time hunter and angler, and then on top of that now full-time farmer. So we were able to get a hold of a little bit of land. So and I'm always out there planting trees just because the wind is so brutal. So I just joke with everybody that I'm a farmer now. I did grow up on a farm, and that's kind of what started all of this and why I would want to come back to Nebraska, the Midwest. But I have three kids at home. One is 6 days old, 7 days old.
Yes, and congratulations.
Yeah, thank you.
Yeah, that's exciting time.
Yes, it is. And, this job compared to my job and residency and fellowship, I can do that because I just live down the road. So, my wife brings the kids by the clinic a lot of times to parade them around because everybody likes seeing little kids, especially newborn babies. Even though they don't do much, everybody likes looking at them. So, but the kids, we got really lucky we're building a house north of town, but we got lucky with the temporary space we did get was right on a pond. So the kids are always out fishing. And now that the fish are spawning, one of them's got a net and catching them that way. But we've talked about catch and release so that they can make more.
Yeah.
But they're just always outside, and the dream is coming true of calling them in now when it's too dark for them to be outside anymore. So whereas, historically this time of year in Phoenix is miserable and you only want to be indoors. So.
Well, and Columbus is just that perfect community to live and practice. And again, I know I'm a little biased growing up here, but definitely can have meet your career goals, but also have a very balanced professional and family life and be a part of your children's stages of life as they grow up. Because if you think you're busy now, Dr. White, you're only going to get busier.
and I'm okay with that. And so is Bree, my wife. She knows that I get bored easily and jump from thing to thing. So if I get bored and I start going down other rabbit holes, we gotta do some more marketing. But I'm not biased, so I can also say that it's the perfect place to live and work because I had no ties to Columbus. I don't have any family or friends here. We've made friends, but it's just a good place to be.
Well, and again, we're going to keep you for many, many years. So, and again, just really, really glad that so grateful you chose Columbus. And it's been a great year. A year ago, you were just starting. So, yeah.
I think a big point to drive home would be that, Columbus is a small community. We like it that way. I can say we now because I've been here for almost a year. Yeah. There's no need to go to the big city to get quality care. You have it right here. And that's not just here at the hospital. The physical therapy offices throughout the city and the chiropractic offices throughout the city. And some of the specialties that we don't have in the hospital come from the big city every week just to see patients. And so there's really no need. And it's more for, patient satisfaction and the ability to not have to drive an hour, hour and a half to have something done, because that just puts a burden on everybody, including the family involved in taking care of them. So everything can be done here. And really there's just no need to go anywhere else.
Very well said, Dr. White. And we'll continue as Columbus Community Hospital to work with you and other medical staff. We'll work with our employees, our volunteers, and our community to ensure that we continue to be best in class as a community hospital. We definitely know who we are and what we can do well, and continue to invest in that. Well, again, thank you, and thanks to our listeners and again, Dr. White with Columbus Orthopedic and Sports Medicine Clinic, just adjacent in Health Park Medical Office Building, Columbus Community Hospital. So thank you. That's right.
Be sure to like and subscribe to Columbus Community Hospital on all of our social platforms, Facebook, Instagram, YouTube. My kids would be able to tell you better, but this was fun. Thank you for having me, and thank you for listening.
Thank you for being our guest, Dr. White.